giving our thoughts about how we could best minimize the damage from this incredibly unique and scary virus. In the last 24 hours, the World Health Organization has called this a pandemic. And if you read the news, you don't know whether or not to be incredibly panicked or not panicked at all. Just a week ago, there was a push to make it seem like this was no big deal. But the reality was, if you look at the curve of rates of infection, it is climbing, and it's climbing fast. If we take collective action now, we can stem the tide here.
This virus, it's not smart. It has no brain. For it to spread, it requires to panic us. If we fall back on what we know we can do to stop transmission, which is the basics, hand washing and social distancing, it will not be able to sustain transmission.
If we do all these things, people may look back in a month or 2 months and say, what was the big deal? Well, the big deal is if we do the right thing, we can make it not that big of a deal.
We can outsmart it, but we have to have the will to act. And now is the time.
So Dr. Spellberg, I'm really excited we're talking again. I'm curious though, if you look back right now at the last 6 weeks compared to our last conversation, with how things have gone, are you disappointed? Where do you stand on that curve?
The good news is that if we look at the Los Angeles area as a microcosm, just because I'm most familiar with those data, we completely avoided, at least thus far, a New York situation. But the cases came down and then plateaued. They have not continued to fall. And as we test more, we're finding more. So we're not as close to being done with this as we would have hoped.
When this is all said and done, I'm putting you on the spot. What do you feel the mortality rate is going to be in this country? Are we way underestimating the number of infections, or do we just have no clue?
The data that are now emerging based on antibody testing does suggest, as many people had suspected, that we are grossly undercounting the actual infections. This is a strange virus. This virus hits some people like a sledgehammer, but it now appears that perhaps as many as 20 people for every one that develops symptoms either don't have any symptoms at all or are mildly sick such they never even present for medical care. So if you count 20 of those for every one person that we're talking about now, the actual number of infections is probably way larger than we currently think.
I want to ask you about your past experiences as an ID doctor. What is it about this novel coronavirus that allows it to infect some people so harshly? What is it about this virus that allows it to do this?
We still don't know lots, and we need to be very careful as experts to pretend that we know things that we don't know. We don't know how is this virus causing disease. It is very clearly different than other infections or even other viruses we're accustomed to seeing. We just don't understand how this virus is causing disease at this point.